Say it like it is. Don't take Tylenol. Don't take it. If you just can't, I mean, it's fight like hell not to take it.
That was U.S. President Donald Trump dispensing advice to pregnant women yesterday, claiming there's a link between the use of the pain medication Tylenol and autism. It's the latest instance of the White House weighing in on heated health issues. Experts say many of the claims are dangerous misinformation. Trump said his warning not to take Tylenol, whose active ingredient is paracetamol, was based on some studies that have linked the drug use during pregnancy to an increased risk of autism in children. But decades of research have debunked any conclusive links. Scientists say the factors are complex. Here's one researcher who co-authored one of the most highly respected studies from Sweden.
We studied 2.5 million Swedish pregnancies, and by having this massive material in Sweden, we're able to account for the reason why the mother uses the medication. So early on, we see a little bit of an increased risk, but the more we account for these confounding factors, the more the risk disappears and eventually goes to nothing. There has been small-scale studies that found some increased risk, but larger scale studies do not support this, including ours. This has also been confirmed by independent bodies who have evaluated the evidence, and they all come to the same conclusion that paracetamol does not confer a risk of autism.
To talk more about public health information and misinformation in the United States, let's bring in Dr. Matthew Motta. He's an associate professor of health policy at Boston University. He's also the author of the book Anti-Scientific Americans: The Prevalence, Origins, and Political Consequences of Anti-Intellectualism in the U.S. Welcome to DW, Dr. Motta. Now, first up, is there scientific evidence to back this up?
Thanks so much for having me. You know, there's absolutely no scientific evidence to back up the president's claims here. What the president and Secretary Kennedy were likely referring to in their remarks were a series of studies, including some new studies, that make an effort to study many scientific studies. These are reviews or analyses of many studies. And some of those reviews have pointed to the potential for a correlation and association between acetaminophen use, Tylenol, and the potential onset of autism. But what newer, more recent studies have shown that have made an effort to account for the heritable or genetic factors that could potentially cause kids to develop autism, those studies that make an effort to account for those genetic factors completely explain away the potential link between acetaminophen use and kids developing autism. Health and Human Services Secretary Robert F. Kennedy Jr. has made it very clear that his administration will not be investigating the heritable or genetic causes of autism, even though researchers think that this is one of the primary causes of autism. It is only by not investigating that link that you can potentially see an association between acetaminophen use and the onset of autism. It is an extremely misleading claim coming from the president, from the Health and Human Services Secretary, and one that I think could have a very deleterious impact on public health.
Before we look at the possible repercussions of this, I want to zoom in on another aspect that I found striking. Trump called on pregnant women to tough it out, and I'm quoting him here. How does that play into the wider pattern of women's pain not being taken seriously?
This was such a fascinating and I think misguided comment from the president, because in the exact same press conference, the president urged all of us to believe women, using a quote that was often used in the Me Too era and by the Me Too movement. The president is trying to have things both ways here. He is encouraging us to listen to parents of kids with autism about what they think the potential causes might be, while completely dismissing the pain that pregnant people experience. Now, where we don't know exactly what the cause of autism is, and while we can't rule out various correlational factors that may make some people more likely to develop autism, there's something that we do know very well, which is that the experience of fever in pregnancy can be very harmful to both the pregnant person and their child. And so not taking acetaminophen when it would otherwise be appropriate can potentially put not just mothers, but children in harm's way. I found this to be a very reckless comment from the president that was frankly at odds with several of the other claims he was trying to make in that press conference.
And you're not the only one. Experts across the board pretty much have called this dangerous, anti-science, and irresponsible. Can this be reasoned with, though, or is the damage done? Will Tylenol now forever be associated with autism, even if it's wrong?
This is such a fascinating question, and it's one we're going to have to monitor in the coming weeks and months. We don't have a definitive answer now, but what research from my colleagues and I suggests is that when someone like President Trump, when these high-profile political and partisan figures touch issues related to science, even issues that may not have been so politically polarized in the past, the public tends to follow suit. We are seeing that play out right now in the United States with the water fluoridation issue. Personally, water fluoridation was not an issue that I expected to become politically contentious, but in 2025, when Health and Human Services Secretary Robert F. Kennedy Jr. suggested that the CDC would no longer recommend adding fluoride to water, we've started to see a split in public opinion polls, such that supporters of the president tend to feel more negatively toward water fluoridation, and those who are his opponents tend to feel more positively. We don't have the public opinion data yet, in part because polls take a while to conduct, and the presser happened just a few hours ago, but I suspect that we are going to see similar politicization of Tylenol, such that folks on the ideological right and supporters of the president come to be more likely to see it as potentially dangerous. So that's something we're going to look out for in the next couple of weeks.
It wasn't just Tylenol, though. The president also made completely unfounded claims about vaccines. He talked about babies being pumped full of liquid and that combination vaccines were harmful. How dangerous is that at a time where vaccine hesitancy is already on the rise?
This is very dangerous rhetoric coming from the president. I mean, among the misguided and misinformed claims made in that press conference included the idea that we need to separate measles, mumps, and, although he couldn't come up with a third, rubella vaccines and administer them separately. There is no scientific evidence to suggest that this is an effective way to administer the vaccine, and in fact may lead to kids getting sick in the time in between administering each of the vaccines, especially in a world where vaccine preventable disease outbreaks are becoming more common. Other misinformed claims included the idea that hepatitis B is purely a sexually transmitted disease, which is not. Hepatitis B can be spread through contact with infected surfaces, not just as a sexually transmitted disease. This is why vaccination is so important. And what the president is doing right now is sowing public distrust in vaccines and further politicizing vaccine-related issues. It is important to note the context in which this presser happened. On the heels of an ACIP meeting that took place on Thursday and Friday of last week, which makes really important recommendations for all 50 states regarding how it is that they should structure their vaccine policies. The ACIP meeting was marked by confusion, folks on the panel who had recently been appointed not knowing exactly what they were voting for, folks on the panel making an effort to roll back vaccine recommendations that have been in place for decades, and ultimately puts us in a position where people now may be more inclined to accept the ACIP's anti-scientific claims that ultimately could make us sicker, in part because the president of the United States is giving them a megaphone. That's what worries public health experts like me and my colleagues so much, that when the president gives rise to anti-science opinions, people take action on them. That's what we're seeing now.
The ACIP is, just for our international viewers, the Advisory Committee on Immunization Practices. I want to ask you very bluntly, does the president understand what he's talking about here, or is he deliberately misinterpreting the data?
I think that both things can be true at once. I think that the president doesn't quite know what he's talking about when it comes to vaccine-related issues, a fact which, to his credit, he did make clear during the presser yesterday, struggling to pronounce the word acetaminophen, not remembering the names of different vaccines that he thinks should not be administered. But at the same time, we knew this press conference was coming. Health and Human Services Secretary Robert F. Kennedy Jr. announced months ago that a potential cause for autism would be announced in September. This is not how the scientific process works. We don't get to simply call our shot and say on this date we are going to know why something does or does not happen. We need to subject these claims to rigorous research. The president and Secretary Kennedy made the decision that at some point in September, they were going to link something to being the cause of autism. We knew from Kennedy's comments that it would be some environmental factor. And what we ended up getting yesterday was a mix of vaccine-related explanations, primarily from the president, and Tylenol-related explanations, primarily coming from Secretary Kennedy.
We only have 30 seconds left, but I do want to ask you what scientists and the leaders who follow their advice can do to counter the damage being done.
Scientists need to put scientific messages out there, as scary as it is right now. Engaging with the science, engaging with the public on their own terms is one of the most important things we can do to make sure that people have conversations like the conversation that we're having right now to separate fact from fiction and make sure that folks follow the science in the actions that they take every day.
Dr. Matthew Motta of Boston University, pleasure speaking to you today. Keep up the good work.
Thanks so much.